Welcome to This Explainer. You know that exhausted feeling you get when you're just trying to be healthy, like it's a second unpaid full-time job? Well, we're unpacking why that is today. Spoiler alert, if you're constantly drained trying to make the right choices, the hidden culprit is literally the architecture of our daily lives. So let's kick things off with a pretty massive question to hopefully relieve a little bit of that guilt you might be carrying around. When you skip the gym or order takeout for the third time this week, are you actually failing at being healthy, or is the world built around you setting you up to fail? Picture a scene you probably know way too well. You're standing at a chaotic city intersection, it's loud, traffic is flying by, food delivery riders are weaving around you, your screen is glowing with notifications, and literally everywhere you look, there's a giant flashing ad for a burger and fries. When your environment is this aggressive, maybe your willpower isn't the problem at all. Maybe it's just this insanely high-friction world we're forced to navigate. That brings us to Section 1, the willpower myth. Because look, every single day we are blasted by the exact same public health megaphone, right? Eat healthier, exercise more, get some sleep, reduce your stress. But here is the wild thing. Chronic diseases are still climbing globally. It turns out just shouting information at exhausted people and expecting their behavior to change practically never works. It really all boils down to this. Human decisions are shaped by what's available and what's convenient, period. If a donut is sitting right there on the counter, but getting an apple means walking 3 blocks and hiking up a hill, well, human nature takes the path of least resistance every single time. Convenience is always going to be education. Let's move on to Section 2, the unhealthy default. Let's step back into that chaotic city story for a second. Think about an average day for a lot of us. You sit in endless traffic for your commute, then you sit in a sedentary office, fighting off sugar cravings while the vending machine practically stares you down from down the hall. By 5 p.m., your decision fatigue is absolutely maxed out. You're playing against a stacked deck, where the default option is almost always the unhealthy one. So, how do we flip the script? Section 3, designing healthy systems. Okay, now I want you to imagine taking that exact same commute, but the environment has been radically redesigned. It's like night and day. Instead of dodging cars in a smog, you're cruising down safe, dedicated cycling lanes. Instead of sugary energy drinks at every checkout, there are free public water stations everywhere. It's a completely frictionless world. You don't even have to use willpower because the healthy choice has magically become the absolute easiest choice. This is what experts call health design. It's basically the science of building environments that put healthy behaviors on autopilot. Instead of finger wagging and lecturing people, health design relies on these powerful, system-wide, invisible nudges. Which leads us to Section 4, the economics of prevention. And here is the really cool part about this. This isn't just some utopian pipe dream. It makes incredibly hard economic sense. When we actually implement these environmental nudges, we see this massive inverse relationship. Basically, healthcare costs plummet, while workplace productivity absolutely skyrockets. Just look at the data. When you shift the default, population-wide rates of obesity and diabetes go down, while general well-being and longevity shoot up. It's wild to think about, right? The absolute cheapest health intervention out there isn't some miraculous million-dollar new medicine. It's literally just designing out chronic diseases before they even start. Finally, Section 5, stop blaming, start designing. I want to share this quote from our source material because it really hits the nail on the head. The most effective public health intervention is not convincing people to make better choices. It is designing systems where better choices happen by default. That's the whole shebang. True, lasting prevention is entirely about design, not persuasion. It totally flips our perspective, doesn't it? Public health really is just the science of designing environments where healthy decisions are the absolute easiest ones to make. It is high time we stop blaming individuals for systemic failures and just get to work structurally reinventing the spaces around us. But as we think about redesigning our physical cities, it leaves us with one pretty provocative question to wrap up this explainer. We've talked a lot about physical spaces, but what about our digital ones? Is the attention epidemic, that constant digital distraction inside the devices in our pockets, becoming the newest risk factor for population health? It is definitely something to chew on the next time you blindly reach for your phone. Thanks for hanging out with me for this explainer. Catch you next time.